Hello, my name is Caitlin Boyles. I am an Indiana State University nursing student in the LPN to BSN program. This is Clinical Video 4 for Community Health Nursing 444, Communicable Diseases, Conditions of the Skin, Part 2. If you are interested in listening and viewing Conditions of the Skin, Part 1, please check my YouTube channel. Additional information about this presentation. This presentation is geared towards parents and caregivers of young children. If you have not already done so, please pause this video and take a moment to take the pretest. The link is posted in the video description below. By the end of this presentation, you should be able to describe hand, foot, and mouth disease, list symptoms of hand, foot, and mouth disease, identify transmission of hand, foot, and mouth disease, list ways to prevent hand, foot, and mouth disease, and recall care for hand, foot, and mouth disease. Additionally, you should be able to describe head lice, list symptoms of head lice, identify transmission of head lice, list ways to prevent head lice, and recall treatment for head lice. First off, we are going to be talking about hand, foot, and mouth disease. Description. Hand, foot, and mouth disease is common in children under 5 years of age, but anyone can get it. It is characterized by lesions on the mouth, followed by a skin rash, usually located on the palms of the hand and soles of the feet. This rash can also occur in the buttocks area. Symptoms of hand, foot, and mouth disease start with the sudden onset of a fever, feeling poorly, a poor appetite, and a sore throat, followed by lesions on the mouth that typically occur 1 to 2 days later. These lesions are usually located on the tongue, gums, and insides of the cheeks. The skin rash typically develops on the palms of the hand and soles of the feet, hence the name hand, foot, and mouth. Hand, foot, and mouth is transmitted by direct contact with discharges from the nose and the throat, or through the fecal-oral route. The incubation period for hand, foot, and mouth disease is typically 3 to 5 days. Infections are most common in the summer or early fall. Prevention of hand, foot, and mouth starts with encouraging frequent hand washing. Also, encourage good cough and sneeze hygiene. Cover your mouth when you cough and wash your hands afterwards, or cough into your shoulder or elbow, and wash and sanitize articles soiled by the discharge. If your child gets hand, foot, and mouth disease, there is no specific treatment or vaccination. Simply wash and sanitize or discard soiled articles. Encourage frequent hand washing, especially after handling discharges and after using the restroom, and encourage good cough and sneeze hygiene. The following ideas may make it easier to eat and drink if your child is having difficulty. Snacks on popsicles or ice chips. Eat ice cream or sherbet. Drink cold beverages such as milk or ice water. Avoid acidic food, including citrus drinks and soda. Avoid salty or spicy food. Choose foods that are soft. And rinse the mouth with warm water after meals. Head lice. Head lice is an infestation of adult lice or nits, which are the eggs, in the hair on the head. Head lice live close to the scalp and tend to be most visible behind the ears or at the base of the neckline. Head lice depend on human blood to live. Symptoms of head lice include itching of the scalp, visibly seen lice on the scalp, nits on the hair shaft, and sores on the scalp, neck, or shoulders from scratching. It should be noted that lice do live close to the scalp, within 1/4 of an inch of the scalp in order to survive, as the nits have to live close to the scalp as a source for blood. Transmission. Head lice can crawl, but they cannot jump or fly. Transmission typically occurs with direct head-to-head contact. However, indirect contact can spread lice by items such as hats, brushes and combs, headphones, pillows, towels, and upholstery. The incubation period for head lice. Eggs hatch in about a week, and the lice are capable of multiplying in about 8 to 10 days. The typical adult louse lives 20 to 30 days and lays 4 to 5 eggs per day. Prevention. In order to prevent head lice, hang garments on separate hooks from other children's garments, especially at school and daycare settings. Avoid sharing combs, brushes, hats, and scarves, and really anything else that could touch a child's head. Do not lie in beds, couches, or pillows that have been in contact with a person infected with head lice. Care and treatment. Over-the-counter or prescription pediculacides. Infected persons should not use conditioner before using lice medication and should not re-wash hair for 1 to 2 days after lice medicine is removed. Detection of live lice more than 24 hours after treatment means that the treatment has failed. If the treatment fails, consult your healthcare provider as a different pediculicide may be necessary. Once effective treatment has been applied, retreatment in 7 to 10 days after the first treatment may be necessary. Please follow the instructions on the product that you have purchased. Household contacts should be evaluated for lice or nits. Launder potentially infected items in hot soapy water or put them in a hot dryer for 30 minutes. Brushes and combs should be thoroughly cleaned or boiled. The presence of lice is not indicative of poor hygiene or an unhygienic environment. Post-test and additional resources. Please take the time to go back now and take the post-test. The link is provided for you in the video description below. There is also a link to a printable handout posted in the video description below. These are the references that were used for this presentation. Thank you for your time.